I'm not only a surgeon, but this week I'm a patient, and I'm really excited. Over the years, patients have asked me, have you had breast augmentation? And I say, that's a personal question. I totally don't mind answering it. It's really a personal decision. And I think now that my twins are a little bit older, my practice is, humming along. I feel comfortable taking time away from practice. I feel comfortable taking time away from my family to have surgery and a short recovery. And it just felt like the time was right. And I feel really excited about my decision. I feel excited to walk in my patient's shoes because I help them get through their journey. I really wanted to find a surgeon who would treat me the way that I treat my patients. If I were to have surgery, I would only recommend to you what I would have in my own body. And there's not a one-size-fits-all approach, but I chose to use Natrelle implants because I am now walking the walk in addition to talking the talk, and I'm basically treating myself the way that I treat my patients. I want to feel like me. I've had a little, experience with that when I was breastfeeding. I probably don't want to be that full, which is actually good that I've experienced, after you pump or after you breastfeed, your breasts actually change shape. So I've kind of sized out in my own body, and I really want to feel like me. For breast augmentation, there's always a contemplation phase, and that phase usually is a long time. It could be 1 year up to 20 or 30 years. And I know my contemplation phase was a long time. I always knew someday when I was ready, it's something that I wanted to do. I think during that phase, it's important for women to not feel too overwhelmed, to take time and know that there's so many different ways that a breast augmentation can be done. They should try to find before and after pictures of women who look like them from the start and who have a result that they can relate to. They need to do their homework. They need to find a board-certified plastic surgeon who they can relate to, who they trust, who's going to listen to them, and who's going to work together with them to get the result that they're going for. And really, timing is key in terms of when is the best time to have surgery. I tell my patients, you have to have everything else taken care of. You have to be able to take time off work, usually about a week or so. You need to be willing and able to take time off of exercise, usually about 3 to 4 weeks. You have to have support. You have to have a supportive person to not only pick you up after surgery and hopefully stay with you that first night, but other members in your circle that are going to support your decision. And once all those are reached, if it's the right time for a patient, then that's great. Women can be, and they really should be, supportive of one another. Just like, say you're going to have a brand new hairstyle, and, especially if it looks really good, your girlfriend's like, yeah, that's amazing. I'm so glad you did that. Or say you decide to lose weight and get really fit. You want people cheering you on. I think the same thing goes for breast augmentation. If a woman chooses to have surgery, which is a big deal, it's a really big decision, women should be supportive of her, because really all women, they want to look their best. They want to look their best. They want to feel their best. They want to feel feminine. They want to feel beautiful, and we should support one another.
Natrelle Breast Implants, important safety information and approved uses. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants, although rates are not well defined. Some patients have died from BIA-ALCL. Patients receiving breast implants have reported a variety of systemic symptoms, such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Who can get breast implants? Natrelle breast implants are approved for the following: breast augmentation for women at least 22 years old for silicone-filled implants, and for women at least 18 years old for saline-filled implants. Breast augmentation includes primary breast augmentation to increase the breast size and revision surgery to correct or improve the result of a primary breast augmentation. Breast reconstruction. This includes primary breast reconstruction to replace breast tissue that has been removed due to cancer or trauma, or that has failed to develop properly due to a severe breast abnormality. This also includes revision surgery to correct or improve the result of a primary breast reconstruction. Who should not get breast implants? Breast implant surgery should not be performed in women with active infection anywhere in their body, women with existing cancer or precancer of their breast who have not received adequate treatment for those conditions, women who are currently pregnant or nursing. What should I tell my doctor? Tell your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher. Autoimmune diseases, example lupus and scleroderma, a weakened immune system, example taking medications to decrease the body's immune response, planned chemotherapy or radiation therapy following breast implant placement, conditions or medications that interfere with wound healing and blood clotting, reduced blood supply to breast tissue, clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Those with diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What else should I consider? There is a boxed warning for breast implants. Please see bold text at beginning. Many changes to your breasts following implantation are irreversible. If you later choose to have your implants removed and not replaced, you may experience dimpling, puckering, wrinkling, or other cosmetic changes, which may be permanent. Breast implantation is likely not a one-time surgery. The longer implants are in place, the greater the potential risk for complications. You will likely need additional surgeries on your breasts due to complications or unacceptable cosmetic results. Thus, you should also consider the complication rates for later revision surgery, since you may experience these risks in the future. Cancer treatments and surgery will affect the outcome and timing of breast reconstruction. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent. Even if you have no symptoms, you should have your first ultrasound or MRI at 5 to 6 years after your initial implant surgery, and then every 2 to 3 years thereafter, regardless of whether your implants are for augmentation or reconstruction. If you have symptoms of or uncertain ultrasound results for breast implant rupture, an MRI is recommended. Additional imaging may be required depending on your medical history and status. The health consequences of a ruptured silicone gel-filled breast implant have not been fully established. Routine screening mammography for breast cancer will be more difficult, and implants may rupture during the procedure. Perform self-examination every month for cancer screening and ask your surgeon to help you distinguish the implant from your breast tissue. Lumps, persistent pain, swelling, hardening, or changes in implant shape should be reported to your surgeon and possibly evaluated with imaging. What are key complications with breast implants? Key complications include reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and capsular contracture, severe scar tissue around the implant. Other complications include breast pain, swelling, asymmetry, wrinkling, rippling, implant malposition, nipple complications, hypertrophic scarring, and implant palpability visibility. Talk to your doctor about other complications. For more information, see the patient brochures at www.allergan.com/products. To report a problem with Natrelle breast implants, please call Allergan at 1-800-624-4261. The sale and distribution of Natrelle breast implants is restricted to licensed physicians who provide information to patients about the risks and benefits of breast implant surgery.